Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest, and we talk about different programs and services available here at KRMC. I've got a great guest on the program today. It's going to be very interesting, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jennifer Rohler. Thanks for being on the show, Jennifer.
Thanks, Jamie.
Can I call you Jen?
Yes, please call me Jen, because if you call me Jennifer, I think my mother's yelling at me.
There you go. So, okay. So, Jen, you're the, what was your title again?
I'm the clinical manager of emergency services.
The ER. What a scary place.
It can be a little chaotic sometimes.
Yes.
Yeah.
And wow, it takes a special nurse, I think, to be able to be in the ER, and you're on all the time.
It's a little busy.
Yeah, depending obviously on the day.
You just have to function well in chaos, I think. You just never know what's going to happen next.
Now, did you always want to be an ER nurse? How did you get into the ER?
Well, kind of more by accident, I think. My mother would tell you I always belonged there.
The chaos side?
The chaos side, I think. I started in pediatrics.
Oh, I didn't know that.
And med-surg, and then kind of over the years transitioned over to, I worked as a float nurse, and while I was floating, eventually found that I loved the ER, and then I've been there for over 10 years now.
Oh my goodness, I didn't realize that's a long time to be dealing with chaos on a daily basis.
It's where I love to be.
And that's what everybody has strengths and weaknesses, and obviously you found your strength. That's a cool thing.
It is the place for me.
And one of the things, of course, in ER, and I think what makes our ER, and maybe others too, but is that everybody has their roles and their places, and you know what is expected, what you need to do when a case comes in, right?
Exactly. And our team does know exactly what they need to do when you show up in our world.
Yeah, and they come from both ambulance or walk-ins.
That's correct.
Helicopter.
There's many different ways to show up in our department. People walk in the front door. They're brought in by loved ones. They're brought in by ambulance. Sometimes they come in by helicopter. Sometimes they're visitors here in our hospital, and they get brought down because
they're visiting someone else, and then they get
that wasn't unexpected.
Right. So you see everything from stitches to heart attacks and strokes, everything.
And everything in between.
Yeah. Wow. Now, what would you say, from your experience, is, well, okay, well, I'll ask this different. The most important thing for a person when they're coming into the ER is what?
Some sort of identification would be exceptionally helpful. There are there's medical ID tags. There are a road ID tag. If you are out running perhaps and you suddenly went down, there's this company called Road ID that has something that you can put your cell phone in, or an ID tag.
So is it like a little wrist
It's like a little wristband. Okay. There's medical alert tags. For my mother-in-law, we went and made her a dog tag over at Walmart so she can put it around her neck in case she were to become confused, that we could contact my husband. A medical alert tag bracelet that offers us information about what some of your health history is, something like that would make a difference.
So if you're diabetic or allergic to something,
yes, something like that would help us if you aren't able to tell us that information
Right.
yourself.
I guess that's what I was thinking is that, I mean, hopefully for the most part, people come in and they're cognizant and able to communicate, right?
Right,
But I'm
'cause
sure that doesn't always happen.
That doesn't always happen. Lots of times you're able to tell us yourself, though.
Or hopefully you have a family member with you that's able to fill them in and all that. Now, I know the ER is a team. It's not just a doctor. It's not just a nurse. There's an awful lot of people that touch every patient that comes through there, right?
That is correct.
So, like, let's give them some examples. If I come in to the ER, first thing you triage, right?
The first person that you'll expect to come in contact with a lot of different people. You're going to come in contact with a triage nurse if you were to come through the front door, an admitting clerk.
Okay.
You'll come in contact with another nurse who would be most likely your primary care nurse. You'll come in contact with a physician, probably a resident, maybe even a medical student.
Okay.
You'll probably see a radiology personnel who might take an x-ray or even a CAT scan tech. You'll see a phlebotomist who may draw your blood. They may or may not start your IV, or your nurse will start your IV.
Okay. That's what I was thinking. There's such a wide team, I know, that impacts the patient care in the emergency room. And that's long before they ever get up to the floor.
Right.
And there's, of course, I guess the best case scenario is you treat and discharge, so you're able to fix them up and send them home. But there are times when they have to go up on the floor as
Yes.
well. So then I guess you're working, not maybe the patient isn't aware, but you in the ER team are working up on the floors trying to identify a room, a bed available for the patient. So even in the main hospital, they're working with you, right?
Exactly.
To get them through.
About the time if we decide we're going to keep you, then we have the nursing supervisor working on arranging a bed upstairs
Okay.
and working with the inpatient team to make that bed available for them.
Yeah. And that's, like we talked about, that's that whole team approach, that it's multidisciplinary, if you would, that covers
Exactly.
the whole realm of everything that needs, because there's a lot of tests a lot of times that have to be done to identify. I mean, it's one thing if you come in with an obvious broken bone, but if you've got some other things going on and it's not obvious right away.
Sometimes it takes a little longer.
Yeah.
Sometimes patients are not admitted to an inpatient unit. Sometimes we can't decide right away, and we might admit them to an observation unit where they'll
Okay.
stay for
Up to 24 hours, right?
24 hours
Yeah.
while we do some additional testing to try to determine what else is going on with
Or
them.
to stabilize them and see if we can make them well enough to go home.
Right.
And then there's times, of course, that we have to send them somewhere else. That's usually if we don't have
The
that
services.
particular
Right.
service. I know, like urology or neurology, is it? No.
Some of the
Right.
neurology we'll have
Yeah.
to send. We do have telemedicine with Mayo.
Right.
So
The stroke doc and
we have
some of those
stroke
pro-
service, stroke doc, which we get to see the neurosurgeons.
Right.
And they do teleneurology consults here, so we can have a patient as an inpatient here at the hospital, and they can consult with the neurologist here. So
That's
a
pretty nice.
benefit.
Oh, for sure, because obviously, both from the patient as well as the family side, it's better if they can stay here versus
Absolutely.
being shipped somewhere else. I mean, just the transport costs alone, are not, not to mention the family having to follow and
the
stay at a
travel
hotel.
expenses.
Yeah, all of
Huge
that.
benefit.
I've always said the best thing we can do is try to keep them here in Kingman, if at all possible. So those, and I know that the ER team works really hard, and having that relationship with Mayo has certainly benefited us and our ability to keep them here. I think
Absolutely.
there's a lot more that we don't have to ship that we used to.
I think so too.
Yeah, so that's a good thing. Now, we were talking about the road ID program, and I don't want people to think that that's just for bicyclists, because I think it comes in handy for runners as well.
Absolutely, runners.
Anytime you're out and maybe aren't going to carry your wallet or your purse, so maybe even if you're going to go to a concert or something where you'd want to leave your stuff in the car, but you still never know. I mean, it's just good to have an ID on you at all times.
Absolutely. There's so many times when you just don't know what's going to happen, and You need to have some form of identification
Or
on you.
boating even. You know, you could be out on the lake and have a problem.
Right.
And I don't know that I'd want my cell phone in there probably.
But sometimes it's just a band that has your name and identifying information so that we can figure out
Kind
who
of a
you
next
are.
of kin, yeah.
Who are you and who should we call in the
Yeah.
event of an emergency
Yeah.
to get that information?
Does
if we
that
don't
happen
have
a
it?
lot? Do you get a lot of cases like that where people come in and,
We don't know who they are?
yeah?
Oh, I would say a few times a month,
Yeah.
maybe 2.
So not a whole lot, but
Not
enough
a whole
that,
lot, but enough. And then it takes a little while to try to figure out who you
Yeah.
are.
yeah.
And hopefully somebody will recognize you or come looking for you.
Maybe one advantage of living in a small community is we know each other. Hey, that's Charlie.
I think I recognize that person. Yeah. But, you know, it's
But
still
if
not
you're-
ideal. Or,
No,
you know,
or you're traveling and
and
get
if
that.
in a car accident, if the vehicle rolls and your ID gets thrown
Yeah,
around the
stuff-
vehicle,
yeah.
it may take a little while for us to find that ID to figure out who you are.
Yeah. Does like the tow company and stuff like that work with you guys when they're bringing vehicles in? Do they?
And the
is
police
it-
usually are the ones
police
to
are-
help us
Okay.
get that
Okay.
information.
Yeah. They're another, I know both police and fire work really closely with you guys. I mean, a lot of times they're they are first responders, duh. So they're first, which means they're first on the scene. So they know, I guess have been trained to know what they need to look for and what they need to bring with them, hopefully, to the ER department. And there's some pretty cool things I think as I recall, that we've been doing from the ER side with our first responders, right? There's equipment now in the ambulances that they're able to communicate with you guys ahead of time when they're coming in, like with a heart attack or something?
They have the ability to transmit EKGs. So
Okay.
if you are having a chest pain or a heart attack, they are able to run the EKG right there and transmit it to us.
So you're kind
So
of ready when they...
if you are having a heart attack, we can send you directly to the cath lab versus having you stop in the emergency room. So you can
Okay.
get the treatment that you need immediately.
Fast, yeah.
So it's really important that if you are having chest pain that you call 911.
Yeah, very good.
Hugely important.
Okay.
Can't stress that enough.
Okay, good. Well, Jen, thank you for being on the show. I think we're going to have your counterpart on here, the second half, to
All
talk
right.
a little more about Medical Alert. And I appreciate you sharing your information.
All right. Thanks, Jamie.
Okay.
been
Stay
a pleasure.
tuned. We'll be back right after these messages. If a mom's got a baby that's running a temp, what is the point or a temperature that you'd say, okay, bring it in? Welcome back to Your Health Matters. Earlier in the show, my guest was Jennifer Rohler, and now I'm going to be speaking with Jenny Griffin, who's also in the ER department. Thanks for being on the show,
Thank
Jenny.
you for
and
having me.
Sharing the role here with Jennifer.
Absolutely.
I'll get you guys straight, Jenny. So before the break, Jen and I were talking about the emergency room, all the hands that touch the patients, and the importance of having some form of ID on you, really, at all times.
Right.
And I mean, I was sitting there thinking, no, I don't have anything on me right now, but I think you guys would all be able to identify me if something
Right.
happened. If I keeled over right now, going, oh, no, it's a big one. But medical alerts, we wanted to talk some about,
Right.
and those come in many different forms,
Right.
obviously. What, wristband? What,
Wristbands, they can be on a dog tag like Jen was talking about earlier. They can be on a necklace. Most of the time we look for the wristbands. You know,
so you kind of know if someone comes in
Right.
to check those spots.
absolutely. Even if someone has a dialysis shunt in their arm and they'll have a band on their arm that says off limits, or same thing if they've had a mastectomy on one side, they'll have an off limits band.
Oh, I haven't
knowing
even
not
heard
to
of that
start,
one.
do blood pressures there
Yeah.
or start IVs in that arm.
Oh,
So that's another
good.
thing.
I'm
that we
always
look
thinking
for.
of medical alerts more
Right.
as like diabetes or allergies.
asthma, epilepsy,
Yeah.
all that kind of stuff.
I haven't seen an off limits one. Now,
So
is
that's also something we look for.
okay, and
Yeah.
that makes sense because again, I didn't realize, every time I do this show, I learn something new.
Right.
But I didn't realize that someone who's had those conditions, you
Right.
wouldn't want to
You don't really want to do anything to those arms.
Okay, so interesting, very
Yeah.
good. So, to check those, and they're pretty simple to get, aren't they? I
Right.
mean,
You can buy them,
online
I mean, even at the gift shop over in the hospital, they sell them.
Okay.
I've seen them before.
Yeah.
Online, drugstores.
Okay. And for
much
those
anywhere.
conditions you're talking about for off limits, does the doctor usually tell you, by the way, we don't
Yes,
need
absolutely. The patient is informed that they, to tell the nurses, to tell anyone, don't take my blood pressure there, don't start an IV there,
Okay.
all that kind of
Yeah,
stuff.
it would be important to
Right.
know that.
Yeah.
So how long have you been an ER nurse?
I have been an ER nurse for about 4.5 years. I've been in the ER almost 5. And that's the only place I've worked as a nurse. That's my home. I love it.
Oh, good. I think Jen and I were talking earlier about how it takes a special person.
Right, yeah.
Because you're
Yes.
constantly pretty
I
much.
function much better in chaos than I
Right.
do when it's not busy.
I guess that's
strangely
got to
enough.
be one of the personality tests,
Right.
is how do you do in
Yeah.
chaos?
Yeah.
And that's awesome.
Right.
It really is, and it takes a special person. So
Yeah.
we're blessed to have both Jen and Jenny in the ER department that
thank
function
you.
that way. So one of the things also we wanted to talk about was, how does a person know if they should go to the ER, or could they just go to Fast Tracks or wait and make an appointment with their primary care?
If you have something simple like an earache or a sore throat, a cough, anything like that, you should probably call your primary doctor, or you can probably be seen quicker at Fast Tracks, because in the emergency department, we have to prioritize emergencies. We're obviously going to be dealing with stroke patients, cardiac arrest patients, heart attacks,
Life-threatening.
motor vehicle accidents, all of
Right.
that stuff first. So the wait, absolutely we'll see you, but the wait
Sure.
could be a little bit longer.
And I think that's important, that people need to realize, I've heard people say this, where they're sitting in the ER, well, I've been here for an hour and they
Right.
just came in. Well, they're probably a lot sicker
They
than
might
you
be
are.
having chest pain.
Right.
You just don't know what's going on with the person who went
Right.
back before you, and chances are there's a reason they did, because they could potentially have a life-threatening emergency
Right.
happening. So
And that's part of what the triage nurse does,
Absolutely,
right?
yep.
Is kind of identifying
Yep,
what
and
the symptoms are, how serious, what level they need to be
Right.
seen.
Yep.
Okay, and then the other thing too is, a lot of times when you're sitting in the waiting room, you don't know what's coming in through the ambulance
exactly,
doors.
exactly, and that
Or how busy they are in the back.
Right. Yeah,
Yeah. So
that definitely makes a difference.
yeah, and probably the time of day as well. It's got to be a challenge.
Yeah.
And I would think moms with babies and young children, if they're running a temp, things like that, and especially first ones, we all know the first baby's much more
Right.
fragile.
Yes,
than the
exactly.
rest.
Yes.
My husband and I were talking about that with our grandchildren the other day, and how the first baby, germs,
Yep.
everything you're so
Yep.
much more conscious of. The second one, it's
Right.
like, oh, go for it. Yeah,
Right.
just-
Yeah, it's so true.
So, what do you think when, if a mom's got a baby that's running a temp, what is the point or a temperature that you'd say, okay, bring it in?
Well, typically we instruct them to give them, Tylenol first of
Okay.
all, because Motrin you don't really want to give to anyone under usually 9 months old.
Oh, okay.
So depending on their age, medicate them at home first with Motrin and Tylenol. If it's not coming down, if baby's not eating, drinking, not making wet diapers, all those kinds of things are things that need to be come back to the ER.
Okay.
But if the fever's coming down with Tylenol, Motrin, they're eating, drinking, playful, acting themselves, that's absolutely something that probably just will go away in the next couple days, run its course, or can be seen with a primary doctor. But
Well, and I would think it's the middle of the night ones that are the tough
Right,
ones, right?
yeah.
Because then it's hard to get a hold of your primary care.
Yes, for
Fast
sure.
Track's not open, so then
Yeah.
they're more likely to come
Yeah.
into the ER.
yeah,
But during the day, and Fast Tracks, I think, is open pretty much like from 8 to,
right. They have
pretty
pretty
wide,
good hours.
Yeah.
Mm-hmm.
And even on the weekends, I think they're open on Saturdays at least. So I know my son and grandkids have gone to Fast Tracks many
Right.
times, just like you said, because it's faster.
Right.
They can get in and out quicker
Yeah.
usually.
Yeah.
And truthfully, it's a little less expensive because,
Yeah.
again, you're not having all of that
Right.
extra care that you may not need going to the ER.
Right.
So have you personally seen the value, do you think, of medical alert bracelets?
Yeah, absolutely. I've, several times there's been patients that come in from the ambulance unresponsive, or when the ambulance or, the first responders gone on scene, say they're unconscious, unresponsive, say a bystander called EMS because they saw someone, say, and they have a tag that says they're diabetic. Well, obviously the first thing they're going to do is, maybe just give them some sugar, start an IV, give them some dextrose, check their blood sugar, see what it is,
and their insulin reaction somehow.
Right. Yeah. So
that's good to know.
Yeah,
and
for
again,
sure.
the importance of having those if you have any kind of a condition that people should know.
Absolutely.
And I know Jen and I talked before the break too about the road ID, and I know those are available online if you just
Right.
Google
Yes,
road ID.
yes.
Actually, they've been a sponsor in the past for the race that we do, the race for hospice, the foot race, and for bicycle races as well.
Yeah.
And they just really help reinforce the importance of having some kind of an ID on you
Right.
when you're doing something like that where you don't
where you could
normally have
pass
your-
out or something
Right.
could happen.
Yeah, get hit by a car.
Yeah.
I mean, obviously we don't want those things.
Right. But they do happen.
But yeah, better to
Unfortunately.
better to be safe than sorry. So now, did you do your nursing training and all of that here in Kingman?
I did. I went
went
to MCC, Mojave Community College.
Oh,
and
you're at two.
yes, and I've worked at the hospital for almost 9 years now. I
my.
started as a UC CNA. So.
Oh, excellent. You're one of those success stories. That's awesome.
Well, thank you.
Well, that's cool, though, to see our young people
Right.
and to show them. I talk about that all the time, but it's nice to know people that have actually done it
Right.
and gone through the system. So, and so did you start out as a UC and that kind of just
Yep. Well, I
tweaked
started as
your
a CNA,
interest?
and I was like, well, I could be a nurse. I could do this. So, went to nursing school right after high school, and been in the ER ever since I graduated.
Wow.
So.
That's really cool. That
thank
is
you.
cool. What do you have advice maybe for young people that are looking at going into healthcare, into nursing?
I say just do it. Just,
Yeah.
start young, start early.
So
Get all
maybe
your
go through the
classes done.
volunteer program first.
Volunteer at the hospital. Just, get your feet wet, kind of see what it's all about.
Because obviously, I mean, healthcare isn't for everybody.
Right.
Those are weak at
Yes.
heart.
Yeah.
Or
That's
stomach.
true.
You have to be able, and I mean, especially in the ER, you see it all.
You see it all.
Yeah.
And you don't know when it's coming, where it's coming from. Yeah.
Wow. So
Yeah.
again, that chaos and being able to be prepared and deal with it.
Right.
And both good and bad. I mean, you see the good stories when
Yeah.
you are able to help and
Right.
get them better, and then there's others that you're not able to help. And that's takes
It's
a
tough.
special
It's
person
tough.
too. Yeah. We had a guest on the program not too long ago, and he was talking about how he felt that the nurses at KRMC, and what I've seen and heard, I think is very accurate, have that compassion.
Yeah.
And I think part of it is we live in a small community where we know each other.
Right.
And so the people we care for, we touch,
Yeah.
we run into in the outside world.
Yeah.
So it makes a difference.
It does,
And he
it
was
does.
sharing about how, his nurses cry with their patients,
Yeah.
and family. So I'm excited about the medical alert thing, and I think part of the reason I wanted to have you guys on the show to talk about that is to help people be aware of the importance,
Right.
if not for themselves, for their loved ones too. Maybe mom or dad if they're at risk.
Right.
Jennifer was sharing, with her mother-in-law
Yeah.
to have a IDs if they have dementia, things like
Yeah.
that are good to know.
Absolutely.
So I'm trying to think what other kinds of issues there might be besides like the obvious, the diabetes.
Allergies, asthma, epilepsy,
Oh, I knew that.
seizures.
Yeah, those kind of things.
Even in cases like we were talking about, just an ID with a name and a phone number, I've had patients with dementia who were just found driving the wrong way on the highway,
Wow.
all the way from, somewhere back east, and their family's been looking for them, that kind of thing. So
Wow.
just any sort of ID.
Yeah, you
is
think
super
about it.
important.
I've actually seen even like at True Value one day, they had a poster, have you seen this man? It's somebody's father
Right,
who
yeah.
just left one day and
Yep.
nobody knew where he was.
Yeah.
So having some kind of an ID that they would just wear all the time is probably a good thing.
It really is.
Yeah, and I think it both helps the family's mind be at ease knowing that that's,
Right.
you know, that someone's going to have that ID and be able to call them, as well as for the patient too, and for
Yeah.
the ER staff.
Yeah.
It's going to make it easier for you guys.
It does, 'cause it's not always easy to figure out who people are, or
Right.
you know, what if they're allergic to something that we need to give them,
Yeah.
and you just don't know.
Yeah.
So
And, well, like penicillin obviously
Right.
is a big one. I
Right.
know whenever you go in for any kind of a doctor's office visit,
Yeah.
they ask if you're allergic to penicillin.
Right. Yep.
So.
allergies are very important too.
Yeah. Well, Jenny, thank you for being on the program
Thank
today.
you so much for
time.
having me.
And for educating our audience about the different things that they should be aware of. So I hope you learned something new today. I know I did. Join me again next week and I'll have another exciting guest on the program.